Hello, my name is Dr. Andrew Campbell, and I'm a fellowship-trained orthopedic surgeon specializing in adult reconstruction, which means that every day I treat hip and knee arthritis. Specifically, I do total hip replacements, total knee replacements, partial knee replacements, complex primary and revision knee replacements, and hip replacements, and robotic-assisted hip and knee replacement. I did my orthopedic surgical training at Ohio State, and then did additional fellowship training in hip and knee reconstruction at the Cleveland Clinic. And currently I see patients at Orthopedic One locations at Upper Arlington and in Dublin. And today I'm going to talk about something I evaluate and treat every day in the office, which is hip arthritis. It's one of the most common and debilitating orthopedic problems that we see. And first off, I'll just talk to you a little bit about the hip joint. So the hip joint is a ball and socket joint. It's made up of the femoral head, which is the ball, and a round socket in the pelvis. The hip joint is capable of 300 plus degrees of range of motion in all directions, and it transmits huge forces as you walk, about 5 times your body weight. All of the joints in the body are coated with smooth, glistening surface called cartilage, and that serves as a shock absorber for the bones in your joint. And when the cartilage wears away, that's what arthritis is. So arthritis results from the loss of joint cartilage, and that results in bone-on-bone contact, bone spurs, cysts, and inflammation in the joint. And this can be seen best on an X-ray, which is really the best way we have to diagnose hip arthritis. Hip arthritis results in a loss of range of motion, causing stiffness, swelling, instability, and of course pain. And the hip arthritis pain is typically located in the front of the hip, in the groin area, but can also be in the thigh, in the buttock, and some patients even have knee pain. Patients with hip arthritis also have stiffness, and they may complain of popping, catching, grinding sensations in their hip. And they may have a limp, requiring a cane or a walker for balance. They often have difficulty with stairs, shoes and socks, and getting out of a low chair as well. What causes hip arthritis? There are a number of things that can result in the loss of hip cartilage that lead to arthritis. Some people are actually born with an abnormal hip, and that predisposes them to early hip joint wear and tear. For instance, some patients have what's called dysplasia, which means they have a shallow socket, and other patients are born with hip impingement, which means they have extra bony growths on the femur or on the pelvis that lead to premature wear and tear of the cartilage. But really, any process that results in destruction of the hip cartilage can lead to arthritis. And some of those things are infection, trauma, any kind of injury, avascular necrosis, inflammatory arthritis like rheumatoid arthritis, and to some extent, the hip cartilage does become less healthy with age. Unfortunately, we have no way of growing new cartilage, but we do have a spectrum of treatment options that are available to treat the symptoms of hip arthritis. The most conservative and easy option to implement is activity modification, so avoiding the activities and the positions that hurt. Maybe easier said than done. But things like using handrails on stairs, avoiding deep chairs, wearing slip-on shoes, and they may even choose to use a gait aid like a cane or a walker in order to walk more normally and prevent falls from the limb. But even in patients that are used to lots of activity like walking or running, I recommend trying more low-impact exercise like swimming and cycling, because being active is very important, and exercise releases endorphins that relieves pain and makes you feel better. Physical therapy may also have some benefit in mild to moderate arthritis of the hip, particularly to improve function and strengthening and balance. I always talk about weight loss. We've all gained a lot of weight lately, and weight loss can have a dramatic effect on hip arthritis. The frontline medications for hip arthritis really are the non-steroidal anti-inflammatory drugs, or NSAIDs. These include the over-the-counter medications like ibuprofen or Advil and naproxen or Aleve. We do have some prescription strength NSAIDs as well, which are a little more powerful and have some fewer side effects. These medications treat pain, but they also decrease inflammation. Some patients also may benefit from a hip injection. So our hip injections usually involve a combination of a numbing medication and a steroid. So it's a useful diagnostic tool, but it also may provide some long-term pain relief for your hip arthritis. And we do have a number of other types of hip injections available that can be used in specific circumstances. Total hip replacement is a surgery in which the arthritic ball and socket are actually removed, and new implants are used to reconstruct the hip joint. After surgery, we do expect that patients are able to walk on this the very same day. And our current discharge protocols have advanced so that patients either discharge home the same day or the following day after surgery in the vast majority of cases. And most of our patients do return home. It's pretty rare that patients require additional inpatient rehab after surgery. Patients always ask, do I need physical therapy after hip replacement? And the answer is not always. So some patients do benefit from some home physical therapy a few days a week after returning home. And then at the 2-week mark, after I see you in the office, patients may benefit from outpatient physical therapy. But some patients don't need physical therapy after hip replacement. I have a lot of patients who ask me about what approach I use for my hip replacements and whether the surgical approach matters for the outcome of the total hip replacement. I do use the direct anterior approach, but I also use the direct superior approach and a mini posterior approach, depending on patient factors and anatomy and on a case-by-case basis. And I tell patients that total hip replacement is incredibly well-researched, well-studied, and well-honed. And the bottom line is that the data is clear that patients do very, very well after this operation with predictable improvements in pain and function, regardless of what approach is used. Hopefully together we can come up with a game plan that best suits you and your needs and gets you back to what you love to do. So this is my new boy, Jack. My wife and I, Amanda, just had him a month ago, and we're very excited. And hopefully if you come see me in the office, we can see him grow up together.